Good afternoon. It's Dr. Ayagari. I'm with Rodox. I am a pediatrician in the Wilmington, Delaware area, and I have been practicing for about 20 years, inpatient and outpatient. I would like to talk about something that comes up quite often in my practice, which is toddlers and their eating habits. Usually this comes up at a well visit, usually 18 months, 24 months. And toddlers, as you know, they're not the babies that they used to be, where they're pretty laid back, they love their food, they never complain, they never miss a meal. And now you have this creature that's just challenging you and has their own mind, and their favorite word is no. So I make sure, of course, when I'm going over everything, that the growth chart, which is really the crux of a lot of stuff in pediatrics, tells me a lot of information. After I reassure myself that everything is fine on the growth chart and development's on track, I delve a little deeper with my families. I try to find out what's the situation at home, what's their attitude towards food, because those attitudes are inherited. Is it relaxed in the home? Is it a chaotic time of day? Is it happy? Is it stressful? Because that all affects how the child will eat. So I look at also, what are they offering? What types of foods? Does the child maybe have any allergies or some aversion that may be rooted in a food intolerance? The last thing anybody wants to do is offer food that the poor baby can't tolerate. So I go over techniques for toddlers. We go back to the growth chart, honestly, because you have to keep in mind that they eat depending on how they're growing. For example, a teen boy will eat nonstop all day. Nobody has to tell him or worry about him, but they really aren't overweight. They're just in a very fast growth phase. First year of life, the slope is pretty steep because they're growing fast. Of course, they're going to eat every few hours. But a toddler, you'll notice that the slope suddenly flattens out. And that's why, as long as they're happy, climbing, talking, playing, active, they're busy exploring their world. And they're not growing as fast. They level off a little bit because they're busy exploring. So I'm happy if they eat well twice a day. And they're notorious grazers too. So one technique that seems to work is just sitting back, relaxed. You cut up some tiny pieces of fruits, vegetables, whatever bite-sized non-choking hazards, of course, that you can think of. Put it on a plate at their height and just leave it. Another thing is, please, please, please do not ever force your child to eat. It makes the whole experience really miserable, and nobody wants to be forced to eat. And that's something out of anxiety, and well-meaning parents do it all the time, but it's not effective. And then they'll associate mealtime with rebellion and just an unpleasant time. So you want to be mindful of that. So one thing that worked with my kids is I would just keep some food at their level and let them eat from that plate. Chasing your kids, it doesn't accomplish anything, because if they're running and then they choke while they're chewing, it doesn't help. So making them sit at mealtime is always a good idea. And sitting with parents, you'll notice that they want your food. Another thing that is stressful is that the parents, they like to feed their kids, but they can't because their child is busy rebelling. So I always advise parents, hey, take 5 minutes before you serve the kids, just eat so that you're in a good state of mind. And just demonstrate good eating behaviors and good habits. If you're eating healthy and have a good attitude towards food and are mindful that you don't overeat or snack all day, they will usually follow suit. And you know what? If they skip that meal, it's okay. If they're happy playing, that's okay. Let them work up an appetite, and then when it's mealtime again, they'll join you. So these are a couple of things that have helped a lot of families that I have and in my practice, and would love to consult with you. and share some more tips. And I've got recipe ideas, techniques, things to look for, because toddlers are a unique time of life. If you found this video helpful, please share with your friends, share with your family, and I would love some feedback as well. Anything that you'd like me to go over. So this is Dr. Ayagari. I'm with rowdocs.com, and I would love for you guys to check it out. Have a wonderful Friday afternoon.